Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. The feature presentation is Do supplements, vitamins, and minerals reduce cardiovascular risks? And in this presentation, we're going to answer that question. The American College of Cardiology recently reported an analysis of more than 884 studies looking at a population of 883,000 people who are taking 27 different types of antioxidants, vitamins, supplements, minerals, amino acids, and you name it, whatever is available on the shelf of a drugstore. All these patients were taking some form of supplements, and we're going to look at and see, do these supplements really work? Do they reduce cardiovascular risk? Which one reduces what? And how do you measure those benefits? The first thing is, it is very clear the omega 3 fatty acids have been shown to reduce cardiovascular morbidity and mortality. As a matter of fact, the omega 3 fatty acids, which are available in like olive oil or vegetable oils, it's available in various forms of nuts, like seafood like salmon, mackerel, which are very high in omega 3 fatty acids, and of course, shrimp. I would avoid taking these like fish oil capsules because sometimes they may have mercury if it is taken from an unknown source, and you can develop skin rashes from mercury poison and other problems. So be careful about using capsules which say they have omega 3 fatty acids, fish source. You need to be concerned about contamination. This reduces the cardiovascular risk by about 7%, but it certainly reduces the risk of heart disease. You can follow my arrow here, reduces the risk of heart disease by heart attacks by 15%, and the coronary artery disease events by about 14%. So, definitely, the omega 3 fatty acids should be part of our daily component diet, and it can be obtained in the form of natural food products like using olive oil and eating 2 to 3 servings of fish, which will provide more omega 3 fatty acids or polyunsaturated fatty acids. Similarly, an ounce of nuts can provide you with a significant amount of omega 3 fatty acids. So that's an important point which has been shown to be beneficial. And as I said, it is worthwhile adding these supplements in the form of natural food products, namely the nuts, broccoli, seafood, and of course, using oils that are rich in omega 3 fatty acids. Folic acid has been shown to reduce the risk of stroke by almost 16%. So, if you have a family history of stroke and if you have high blood pressure and you're trying to reduce the risk of stroke, you may want to talk to your specialist, the neurologist, and the primary care doctor, and see whether folic acid supplement would be helpful in reducing the risk of stroke. According to this analysis of more than 884 studies, they showed there was a 16% reduction in the incidence of a stroke among those people who were taking folic acid supplements along with other dietary supplies. The next thing is there is a lesser known benefit from some of these other medications because you talk to each individual and they have their favorite thing. Oh, L-arginine can prevent your heart attacks, sudden deaths, and all kinds of stuff. Same thing with magnesium, zinc, lipoic acid. But these items, omega 6 fatty acids, arginine, vitamin D, magnesium is supposed to help in muscle cramps. Magnesium is supposed to help in also stabilizing the muscle function. Vitamin D has also been found to be useful in patients with heart failure. They do reduce the cardiovascular risk, but not to the extent that we see with omega 3 fatty acids or the reduction of stroke in patients taking folic acid. There's no harm in taking these things, but you have to be aware of how much benefit you're going to get. And in the last slide, I'm going to tell you about what to expect when you're trying to supplement your diet with these supplements, vitamins, minerals, and whatever else is listed here. Okay, let's move on to some of the things that have been shown to be harmful in terms of cardiovascular risk reduction. For example, vitamin C, vitamin E, selenium have been shown to have no cardiovascular benefit or bad improvement in diabetes. For example, there was an increased all-cause mortality in patients taking these supplements, like a ratio by 10%. Cardiovascular mortality was by increased by 12%. Stroke risk was increased by about 9%. So it is important to know which is useful, which is moderately useful, and which is not useful. So this is the category that is not useful in terms of reducing cardiovascular risks or stroke risk. Keep that in mind. Here's like a heat map of the whole study. It's very complex looking, but it kind of summarizes what I have told you in the previous 4 or 5 slides. As you can see, here's the evidence of high quality evidence based upon this color gradation. And if you have this sort of light purple, it's like very low quality evidence. Let's just look at this. Folic acid has this blue, which is a high quality. It reduces cholesterol and it also reduces the risk of stroke. Similarly, antioxidants, especially if you come to omega-3 fatty acids, they have been shown to reduce cardiovascular mortality, myocardial infarctions, and coronary artery disease. And the folic acid has been shown to reduce the stroke. Those are some of the main points to remember. But the real challenge comes up as is just an expanded version of that I was talking about. The real challenges comes when you decide what do you take, what antioxidants do you take, and in what form do you take them? Do you take them in pills? Do you take them in capsules? Or do you take them in the form of a natural food, which I told you, like olive oil, seafood, nuts? How much do you take per day? How long do you take them? What are the side effects? As I told you, if you take that fish oil capsules from the stores, it may be contaminated with mercury, which can cause skin rashes. I used to take them and I developed skin rashes, so I had to stop those capsules altogether. So be aware of the side effects from some of these natural products, extracts of fish or any other source which may be contaminated with minerals. The next thing is the medications can cause skin rashes, they can cause aches and pains, joint pains, or they can interfere with your prescription medications. These are things you need to keep in mind. So if you start a new medication or a supplement and you are having problems, the first thing you look for is what is the last thing you started. If it's a supplement, you may want to stop that and see if things get better. The next thing is, how do you measure that these things are benefiting you? There's no test. There's no like a measurement that you can use to say, hey, this was my risk here before, this is my risk here now. Based on this particular analysis, retrospective analysis, it shows that it reduces the risk from anywhere from 10 to 15%. And the question is, how do you measure when it comes to yourself? We don't have any parameters to measure that. And the next question is, who do you go and consult? Your primary doctor is not going to spend all the time to tell you what antioxidant is better for you, which vitamin is good for you, or which mineral supplement is good for you. You may have to do all this research, so you may have to rely upon Dr. Google. So do you want to put your healthcare in the hands of Dr. Google? So the simplest approach I would say is try to do things that have been proven to be effective. Omega-3 fatty acids in the form of natural resources like oil, nuts, seafood. I would definitely look into that. Number two, folic acid, especially if you have history of family history of strokes, or if you have hypertension, and you need to consult with your primary doctor or a specialist and see whether you should be taking folic acid. And here's a reference to this article. You can send a reference copy of this to your doctor before you visit the doctor. Have them study this and see if they think this will benefit you. And that's how you do it. And as I said, you have to take it lifelong. So it is not something that you can take it for a week like you take an antibiotics for pneumonia. I mean, this is something you have to take lifelong. So you have to make sure you don't have any significant side effects from whatever you're taking. Hopefully, this will enlighten you as to the real knowledge about supplements, vitamins, minerals, and micronutrients, and how much benefit you can expect from them, and how you go about selecting these items from natural sources. And hopefully, you have a much better cardiovascular risk. Thank you so much for watching. I am Dr. Nik Nikam, and please do subscribe to our YouTube channel. I will see you in the next